Hello, today we're going to talk about Ewing sarcoma. Thank you to Path Presenter for this slide of a child with a painful bone mass. It should show a periosteal kind of reaction to it. And here we see fragments of a bone biopsy, or maybe it's a resection, I'm not completely sure, but I think the cells of interest are right here. There's background hemorrhage and background kind of um, reactive change and reactive fibroblasts, hemosiderin, and here is our cells of interest. They are trabeculated and solid, and looking closer, they're part of that small round blue cell differential. They're small, but maybe 1.5 to 2 times the size of a lymphocyte, and they have some inconspicuous nucleoli, maybe one nucleoli, and are pretty crowded. There's some areas with maybe mitotic activity here, and so you really can't make this diagnosis based on just histology alone, because a lot of things fall under your small round blue cell differential, including like desmoplastic small round cell tumor, lymphoma. And so you have to do either IHC or molecular to tease out the diagnosis. So you have to remember, for Ewing sarcoma, the most common translocation is T1122. That is a EWSR1, FLI1, FLI1. So if that has the translocation, then it'll be positive for FLI1 if we got an IHC for that. The second most common is EWSR1 ERG. So if you got an ERG stain, it would be positive if it had that translocation. The most important thing for IHC wise for Ewing's, because maybe your institution doesn't have those IHCs, mine doesn't, is CD99. And CD99 can be positive in a lot of tumors, but CD99 for Ewing's will characteristically be strong, diffuse membranous. The whole thing will be block membranous positivity. So make sure to remember that. And another important thing is Ewing sarcoma, though you'll diagnose it on biopsy, and then they will do neoadjuvant treatment on patients with Ewing's, and then they'll do the resection. And what's very important to know is if there is 90% tumor necrosis, because that portends a good prognosis. Again, 90% tumor necrosis, and I suspect this is part of the some of the chemotherapy effect. So I guess this is a resection, and this is just necrosis. So greater than 90% means a good prognosis. If Ewing sarcoma is metastatic, then that portends a bad prognosis. I think the 5-year survival rate is around like less than 30%. So we talked about Ewing sarcoma, how we would work it up molecularly, that T1122 EWSR1 FLI1, and get that diffuse membranous CD99 that should pop up, as well as also positive for NKX 2.2, which I believe has high specificity. All right, well, thank you. I'll see you next time.